I'm Dr. Rick Greene from the UVA Medical School class of 1970, and it's a pleasure for me to be the host of this series where we talk with all of our wonderful emeritus professors from the University of Virginia School of Medicine. And today it's an exceptional pleasure to talk with Dr. Marcus Martin, the past chair of emergency medicine and the vice president of diversity at the University School of Medicine, and who's done many, many other things. So Marcus, thank you very much for being with us.
My pleasure to be here with you today. My honor.
Well, I didn't have the pleasure to be around. I had gone many years by the time you came, I think in 1996.
That's right.
To become chair of emergency medicine.
Exactly.
You're from Covington,
that's right.
Virginia.
Yeah.
And I'm fascinated because every time I ride past West Vaco, that's a sprawling plant.
Yep.
And I know that you went to NC State.
Correct.
And you were going to get into the pulp and paper business.
You're absolutely right.
So how did you get into medicine?
Well, it's a great question. So I grew up a family of 4 other siblings, mom and dad. And my dad worked at the paper mill as a laborer, 6th grade education. His brothers all worked at the paper mill. My brothers worked at the paper mill. And it was just a community where that's was your employment. And there was also the smell of making paper.
Yes.
And we would call it the smell of money. And so, because that's how we, bread on the table.
Right.
And it was my opportunity to go to NC State to study pulp and paper technology and chemical engineering. The way that happened, I had good grades. There were only 40 kids in my class, 20 boys and 20 girls. And my high school counselor said, we should apply for the scholarship to NC State, pulp and paper technology. They select 2 males from the Covington area each year. And at the time, the schools were not integrated. And they had not selected an African American male before. But my dad had a stellar safety record in the paper mill. And I give him all the credit for them coming to me and saying, you got good grades, why don't you take the scholarship and go to NC State? So NC State was the only school to which I applied. While I was there, I walked on the football team and became the first African American varsity player on the football team. So I ended up taking about 21 credit hours, pulp and paper technology and chemical engineering. But lo and behold, the chemical engineering part was what got me into medical school, plus doing research at the paper mill every summer. So it was a 5-year degree, and every summer I'd go back to the paper mill. I would make some money, make paper, learn to do research. And there was a terrible accident at the paper mill one weekend that I was working as a production engineer. This was when I had graduated. I was working in the paper industry for 2 years. A number of guys got burned, broken bones, had fallen about 30-some feet. And some of them were cared for here at UVA. That same year, Eastern Virginia Medical School was opening its doors. And I said, I really like working with mechanical pumps and fluid dynamics, but I think I would want to work with the human pump. So I applied to Eastern Virginia Medical School, the only medical school to which I applied. Now I tell the students now, don't make that mistake. You got to apply to many schools.
Well, that was also a new medical school.
Very new. I was in the charter class.
Right.
24 students. So I entered in 1973. It was a 3-year school, so we went year-round. Had a few days for Christmas, and that was about it. Graduated in 1976, and then I couldn't decide on a specialty. I loved everything. When I did a rotation in the emergency department there, it was at Centara Hospital now, it's Norfolk General. I loved it, and emergency medicine was emerging as a specialty. So I applied to residency program in Cincinnati. But prior to that, I worked as a general medical officer at the Gallup Indian Medical Center. That was during the day.
In New Mexico.
In New Mexico, right. With public health and Indian Health Service, you could pay back scholarships that were received through the federal government. So I ended up in the residency program at Cincinnati, the oldest emergency medicine residency program in the country. When it came time to apply for a job here at EVMS, here at UVA,
Sure.
I'd already spent 15 years at Allegheny General Hospital as residency program director for emergency medicine, as well as the chair of the department before I left. Several of the faculty members we've recruited here, like Chris Guy-Magamy, I trained him in a combined emergency medicine, internal medicine residency program at Allegheny General, and also Dr. Robert Roger. Both of them are emergency physicians here at UVS and at UVA, and Dr. Chris Magamy is one of our leaders, of the medical staff. So I got here in 1996. The Department of Emergency Medicine was just established. The residency program for emergency medicine was just established. I'd already established great relationships on a national level with people like Dr. Scott Siverud, who also trained at University of Cincinnati, and Dr. Steve Huff. I served as the president of the Society for Academic Emergency Medicine and the president of the Council of Residency Directors. So I had a lot of great contacts. Recruiting faculty here was easy, and we got some really good people like Dr. Chris Holstedge. You may know that name. Chris directs the Student Health Center, and he's director of toxicology program. So 10 and a half wonderful years as chair of emergency medicine. And then from emergency medicine, I moved over into Madison Hall to become the assistant vice president and chief diversity officer, and then I became associate, then interim, and then I became the vice president and chief officer.
Did you have any qualms about taking on an administrative position like that?
I didn't. I had a wonderful time taking care of patients in the emergency department, and I think most vividly teaching medical students and residents, and maintain the relationship with medical students and residents, writing letters of recommendation for them to move on into either residency programs or to faculty positions. I viewed the work in the emergency department as the community coming to the hospital, coming to UVA, and I got to interact with a diverse population. All human attributes that you can think about. People don't want to be in the emergency department, but 1 in 3 people will come to the emergency department. And I taught a lot about cultural competency. So I was asked to serve on the search committee for the newly established Office for Diversity and Equity, and I helped to recruit a fellow by the name of Bill Harvey. Bill and I had NC State in common. We're same age, but he had worked there as faculty, and I was on the board of visitors. So he knew I was stepping down as chair of emergency medicine, and then I was looking for this next phase of life, administration. I worked as assistant dean a little at UVA. I didn't think I was going to become the dean of the medical school, but this was a great opportunity for me now to go into the community and interact with the diverse population. The community at large, Charlottesville, Central Virginia, but also the student body, the staff and faculty at UVA. And I've had a wonderful time leading that Office for Diversity and Equity, working with President Castine, President Sullivan, and now President Ryan.
Right.
And so I'm ending that career now in the Office
Well,
for Diversity.
let me ask you, because I know we've done fairly well in our medical school.
Yes. Mm-hmm.
What kind of metrics do you use to measure this? How do you compare us with some other entity or institution?
Very interesting. We have done very well over the last decade across the university in terms of diversifying the student body as well as the medical school. We recruited the most diverse undergraduate student body this past fall that we've ever recruited. About 35% of the students are minorities. This coming fall, the class will be even more diverse. In the School of Medicine, we've been at about 12% African American population coming in students, which is 4% above the national average, which is about 8%. Now those numbers wax and wane a little bit, but for the last 5 years or so, we've averaged around 12%. Underrepresented minority students in total, we've increased from 6% to about 25% on an average in a decade, and we've been as high as 28%. So that is above the norm for national metrics. Now we have room to improve everywhere, including our graduate students or residents, and that's to come. We've had some incidents in Charlottesville, like the summer of 2017, August 11th and 12th, that have deterred some individuals from applying, or when they get here, not wanting to come here. Particularly potential residents from out of state. But all told, it has not significantly hurt our medical school. Again, we are above the average in terms of underrepresented minorities in the medical school.
So let me ask you, this past year, NYU has had a foundation that they now will pay and for all tuition, tuition-free medical school. Is that something that one should aspire to because it would help our diversity issues and bring certain populations into medicine who can't afford it?
Yeah, tuition free would be interesting, you know, as our demographics continue to grow, as we increase in the numbers of Latino, Latinx, Hispanic population and students. Asian population has grown, but there's not been an issue in terms of recruiting Asian students into medical school. African American population has grown, but we've had an issue with increasing the number of African American males. For instance, when I was in medical school, graduating in '76, just a year or two later, according to AAMC statistics, the number of African American males entering the application process and also gaining entry into medical school in both of those measures were lower than they were in 2014. So we have a ways to go, and there's a whole lot of reasons for that. The cost of medical school, the mentoring potential for students in the pipeline, getting students even interested in going to medical school. You know, a lot of students know that they can get a 4-year degree and go out and make money. Free tuition would be wonderful. Now I know for the undergraduate population here at UVA, President Ryan has been working towards maintaining a goal we've always had with Access UVA for low-income students coming in tuition free. So that happens at the undergraduate level. But for medical schools, that would be a wonderful thing. Question is, how do you fund it?
Right.
Yeah.
Let me ask you, what's next in the life of Marcus Martin?
Well, some wonderful things have happened here. 3 of my 4 children have degrees from UVA. Nobody followed me into medical school, but I have one daughter who got her bachelor's in nursing, master's in nursing, nurse practitioner in peds, and her PhD, all from the nursing school here. Now she teaches at Old Dominion University. One daughter got a degree in foreign affairs from UVA, and then went on to GW, got a law degree. She's a member of the College Foundation here. One son got a degree in economics, and he lives in Charleston with 4 of my grandkids. He's an investment banker. My oldest son got his degree from University of Central Florida, so he was the only one that didn't come to UVA. For me, I've had a great honor. Just recently, there was a tree planted in my honor just east of the Rotunda, overlooking the memorial to slave laborers.
Yes, right.
I co-chaired the President's Commission on Slavery and University with President Sullivan being the president, and we are about 35% complete in building this new memorial to enslaved laborers, which has an 80-foot diameter, very similar to the Rotunda, and will contain the names of about 1,000 enslaved individuals who built the university. There was a professorship established in my name in emergency medicine, the Marcus L. Martin Distinguished Professorship of Emergency Medicine. I'm very pleased to see that, and the chair of emergency medicine, Bob O'Connor, sits in that chair. What's next for me is to spend more time with grandkids, the 4 in Charleston. I have 1 in Virginia Beach, and my wife wants me to go with her to do more fishing and crabbing. So whatever she says, that's what I'm going to be doing
But
next.
it seems to me that the life around Charlottesville and UVA will continue to be important for you.
Absolutely. I'm a professor emeritus, and I'm in my office most mornings about 6 a.m. And you know, one of the comments I made when the tree dedication took place on Founders Day was that when that tree grows to be 70 feet tall, I'm sure we'll be looking over towards the Madison Hall. There's a bench in my name there. Probably see my spirit sneaking in to work at 6 a.m. because it'll still be working. And but importantly, one day I hope that my children, my grandchildren and great-grandchildren will come by that tree, and if that tree could talk, the tree would tell them that the seeds planted in diversity here, the work with the community here has grown as strong as the oak tree itself would be by the time they go by and see it.
So well said. We've been talking with Dr. Marcus Martin today, Emeritus Professor of Emergency Medicine, past Chair of Emergency Medicine, and really who has led the entire program in diversity for many years at the University of Virginia. Marcus, congratulations on everything you've done.
Thank you so much. I appreciate that.
Thank
Appreciate the interview.